Growing up, I started becoming self-conscious about my body. I noticed how my group of friends were much thinner than I was, and I would be called ugly and fat by my peers. The bullying I experienced made me feel petrified about attending middle school. My first day was not so bad, but defective when it came to PE class, and we had to run miles for a specific amount of time around the field. And I just couldn't catch up to everyone else. As I was the last runner to approach my PE teacher to give my time, she said that my time had to be better. I felt really down about it and vowed to start losing weight after that. I started to exercise excessively and have a strict diet. Weeks passed and I rapidly shed the weight off. I started noticing huge changes, and everyone noticed and gave lots of compliments on my appearance. It made me feel validated and accepted for the first time ever. After receiving those compliments, I kept going with my unhealthy habit of dieting and excessively exercising. Working out an hour a day turned to 3 hours. I became more and more obsessive with food and my weight. Each day, it got worse after I was praised by my PE teachers because of my best mile times. It got me to believe that being skinny was the solution to everything. Months passed and I spiraled out of control. I feel like my eating disorder was gaining control of my life. I would stop doing hobbies I enjoyed, such as art or singing. I would feel tired, distracted, and depressed. My family and friends got really worried. I was skin and bone and very unrecognizable. My dimples were gone. My paleness overcame my rosy cheeks, and I just felt helpless. One day, my 2 sisters had a conversation with me about getting better, and my niece, named Nazareth, who was about 5 years old at the time, begged me to recover. After that, I realized how worried she was. I was ashamed about my behavior because she looked up to me as an older sister, and I didn't want to influence her that way. Reluctantly, I agreed with my mom about going to the doctor at a nearby clinic. After talking, she diagnosed me with anorexia. The process of recovering was difficult because I was tempted to go back to my old habits until I researched about eating disorders for the first time. And as I saw the word death, I just freaked out and felt helpless, but decided to not give up on myself. It was not a perfect process. Recovery and change is hard, but it's worth it. Currently, I'm in college and I'm still learning to love myself. I have a healthier lifestyle and I wouldn't change anything from the past because it has made me appreciate life and it has made me stronger than ever. Not only did I learn about self-love, but I also learned that perfection of beauty standards does not exist. If you or anyone is struggling with an eating disorder, just know that you are stronger than you think you are. And it is okay to seek help. You are worth so much and your weight does not define you. If I recovered, so can you.
Oh my god, and we totally jumped off the cliff and had to swim all the way to shore because the dog chased us all the way to the end. Oh.
So I'm going to ask that you ladies mute your mic until you are up to speak. I want to welcome everyone and I want to thank everybody for watching today. So I'm Dr. Lakianda Jefferson and I'm presenting for International Women in Psychology. We're going to discuss eating disorders today. This is a global discussion with the experts. We have several different speakers present today. from different countries, and each of our speakers will introduce themselves briefly, and they will talk about what their question is, and they'll address the question's answer and elaborate on that answer in detail for you guys. And then at the end of our discussion, we'll take some questions from you guys in the audience that you may have after listening to our full discussion around eating disorders, how it's properly diagnosed, things that you can kind of watch for, and ways that you can help as family members and friends of people who may be struggling with this disorder, and ways that you can help people that are in the community as well. So without further ado, I'll go ahead and I'll let our first speaker jump into it. And her question is, what are the different types of eating disorders and how they differ? Elena.
Hello, I'm Elena Paula Știubei from Romania, and I am a psychotherapist specialized in working with bodies. There are 6 eating disorders. Anorexia nervosa is when people may limit their food intake or compensate for it through purging behaviors. They have an intense fear of gaining weight, even when they are severely underweight. There are 2 subtypes, the restricting type and the binge eating and purging type. Bulimia nervosa is when people eat large amount of food in a short period of time, then purge to compensate for the calories consumed and relieve gut discomfort. They fear gaining weight appears despite being at a normal weight. Difference between this type and the binge eating and purging subtypes of anorexia nervosa is that people with bulimia maintain a relatively normal weight. Binge eating disorder is believed to be one of the most common eating disorders. Individuals with this disorder have symptoms similar to those of bulimia or the binge eating subtype of anorexia, but they do not restrict calories or use purging behaviors and often have overweight or obesity. Pica is another eating disorder that involves eating things that are not considered food, such as ice, dirt, soil, chalk, soap, paper, hair, etc. Rumination disorder appear when people regurgitate the food they've recently swallowed. Then they chew it again and either swallow it or spit it out. Avoidant restrictive food intake disorder is an eating disorder that causes people to undereat. This is either due to a lack of interest in food or an intense distaste for how certain food looks, smells, or tastes. In addition to these 6 eating disorders above, less known or less common eating disorders also exist, as purging disorder, when individuals often use purging behaviors, but they do not binge. Night eating syndromes appears when individuals frequently eat excessively, often after awaking from sleep, and other specified feeding or eating disorders like orthorexia, for example, when individuals tend to have an obsessive focus on healthy eating. Thank you.
Okay. Let me stop my video. All right. So thank you. I appreciate your thorough elaboration. They're actually the most common types. Did you specifically go into the 3 most common types?
Yes.
You talked about the 6 that we have, but
the common types are anorexia, bulimia, and binge.
Binge purge.
Yes.
Mm-hmm. Okay. So next we'll go into, let's see, what's the second question? How family can be helpful in recovery. And Rachel is going to cover. And that's why I wanted to mention the common types, because this is probably going to be one that kind of elaborates on what we see in I guess the most frequent types of eating disorders.
Thank you, Dr. Jefferson. So my name is Rachel Smets, and I'm an international speaker, I'm an author, I'm a YouTuber, and I really help people to shift their lives and really live the life that they desire and that they deserve. So I really truly believe that you can change your life. But this is all about eating disorders. It's a topic that is very near and dear to me because I've been there. So I know what I'm talking about. And eating disorders is very often known as being something for teenagers, whereas I had it as an adult. And I'm fully recovered, but there are definitely some tips and tricks I can offer to family and of course based on research, but I would like to do two things, and that is first give you a list of 5 items to avoid, because it's always very nice to say, hey, this is the best thing that you can do, but there's also a few very important things that you really should avoid doing. And so I'll first give the list of what not to do and then what to do. So things to avoid, things not to do. First of all, ask questions like, okay, so are you better? Like, are you better now? Like they should like be in a hurry, like, come on, just get over it, right? So those are the kind of, watch the questions that you ask. The second thing, trying to manipulate. Please, please, please try to avoid and manipulate. Like, oh, you're ruining the family, or, just do this for me, or just give it up for me. It's not about you. If you're a family member, a parent, or a loved one, or a sibling, it's not about you. It's really about this person with the eating disorder who's really trying his or her best to recover. So avoid this manipulation. It's not going to work. Number 3, make comments on appearance or weight. Like please try to avoid that and not do that, because an eating disorder is all about how they appear. It is about, having a wrong image about your own body. It is about weight. So if you make comments on that, please avoid that. Number 4, avoid shaming and blaming. Like, oh, you just need to eat. You were hurting yourself. You're hurting me. It's like you. Like point the finger at them. Don't do it. If you hurt yourself, then point the finger at yourself and say something like, I feel, or I am hurt, or I'm feeling this, but avoid pointing the finger to the person who's actually struggling really, really hard. So pointing the finger and saying you is not helpful. And then the last and the 5th, and there's many more, but to avoid is avoid simple solutions. Avoid simple solutions or giving simple solutions like, okay, well, just eat this and then you'll get better, or just eat that and then you'll gain weight. And I'm saying this while I'm hearing my mom telling me that, like, just eat these fries and mayonnaise and you'll gain weight. It's like, no, it's not helpful at all. Or just accept yourself, or just do this. There is no simple solution to this. It's a serious eating disorder. It's a serious issue. So there's no simple solution. So avoid trying to offer these simple solutions. And now I'm coming to the things of to-dos or recommendations, let me say it that way, because let's be honest, every single person is different and should be treated different and should be treated in their unique and personal way. So what I can say is this: be patient. These things take time. It's not about hurry and quick fixes. These things take time. So be patient. Be supportive. Be supportive. Like, I know it can be hard as a family member because you see things happening to your child and you don't get it, but it's so psychological and there's so much things going on that even the person with the eating disorder is not figuring out, is not realizing. So try to be as supportive as you can and help them get therapy. If you're a loved one or a family member, we can't offer that therapy. You have to, you need professional therapy. So try to support them and direct them to a therapist. I think that is the best thing that you can do. And then stay out of the therapy and just, let it happen, but be supportive about the therapy. Then there is explaining your own concern. Like I was saying, avoid, pointing the finger and saying you, but explain what you feel. Like explain, hey, I am concerned about you. I am I don't know what to do, tell me, or let's have a discussion, let's have a talk, and just be as calm as you can. Show your patience, so show your support. And one of the biggest things that I experienced myself is show love. Like, show that you love this person. You know, if it's your child or a sibling, just show love. That's the best of all the tips that I can give, the best one in the whole series here, because the person is hurt, the person is struggling. If you have discussions or arguments, or asking you for quick fixes or giving simple solutions, it's not helping. So, but if you show love, that's within themselves what they miss loving themselves. That's why they're hurting themselves with this eating disorder. There's, of course, I'm not going to talk about all the causes, but by showing love, they will, you know, accept themselves more, love themselves more. And it's just, it's the best thing that you can do. And I know it can be really hard to be patient and supportive and sharing love and giving love, but it's really the best thing that you can do. And I think I'm done. I hope this is helpful, but bring on the questions and I'll just stop talking for now. Thank you.
Awesome. Awesome. I think that you did a great job kind of summing it up. And I think that Rachel took a great stance on that too. Sometimes when we're thinking about what we can do as family members and supportive people, helping people that are struggling with a variety of mental illnesses and diagnoses, we're thinking of, okay, jumping in there and actually doing something. And as a psychotherapist, I always talk about, and I preach and teach, holding space. Sometimes you just have to hold space and you just have to be there, simply being there and knowing the things that you don't need to be doing or don't need to be engaging in is more helpful than actually doing something, because the doing something says that you feel the need or the obligation to fix something. And that means that that person has something wrong with them. And so the worst thing that you could do to a person that's struggling with whatever type of affliction is make them feel like something is wrong with them. So I totally agree. Thank you so much, Rachel. Okay, so our next question is symptoms. Now we're going to explore the symptoms and we're going to talk about how we know if someone may have an eating disorder. So we're going to talk about, are there any warning signs or symptoms, things that we could possibly look for? And Evridiki,
Yes,
I think I got that right.
Yes, thank you. Yes, yes. Yeah, or else every I'm based in Qatar and I'm a coaching and wellness psychologist. And I would like, of course, this is a vast topic, and so I feel a little bit now talking about warning signs. I feel, oh my God, you know, it's like where shall I start? From which type of eating disorder? Because we have different types of eating disorder. And as Elena well said, and she emphasized in bulimia nervosa, I would like a little bit to talk about the warning signs starting from bulimia nervosa, because for me it's a very common eating disorder which I've seen having let's say like really harmful consequences. So I will start with that, and just having some notes here from different clients. We have to look out for warning signs, especially if we have clients or family that they can look for if the client is using the bathroom after the meal, if they refuse to eat in anyone else's presence, if they want to eat alone, if they have any strange rituals with food, such as cutting down in small pieces or eating little pieces of food in a certain order. So talking again and being trying to be helpful coming from a therapist, the therapist side, we have to be very mindful of watching over warning signs such as the ones that I've mentioned. Especially for me, it's very important, especially when they are harmful types of eating disorders, such as bulimia nervosa. So we have to be very mindful on that. Now, other common warning signs. The clients who are into an eating disorder, they're very concerned. There's a lot of guilt. There's a lot of shame. And of course, they're very concerned about their body shape, about the body image. So they talk a lot about their body shape, their image, their weight. They have a lot of weight concerns, talking about losing weight, gaining weight. A lot of them are talking excessively about food, about clean eating. You might hear them use the word or the phrase clean eating, or talking a lot about dieting and being actively on and off on diets. Then concerns about exercising, taking a lot of exercise or not enough exercise. Sometimes they're taking up too much of physical activity while they're not increasing the calorie intake. Anxious or upset if they cannot have enough exercise during the day. Then a lot of stress about meal preparation. Sometimes they're unusually interested in cooking, but they might not be actually eating the food that they are preparing. Then we have, of course, there's a lot of perfectionism and some control over food. They might appear getting very upset when they're unable to control a situation related to food. For example, if the dinner plans are changing, or if the restaurant is not serving the food that they're about or they are planning to eat. So all different kinds of warning signs, and throughout the years, I have seen a lot of mood swings, switching between being depressed or very suddenly they might get happy, but most commonly depressed, anxious, irritable, getting very easily tired, more than normal. And of course, we have to stress also the adolescence. Adolescence. I mean, during adolescence, all of you might. I'm sure you have a lot of experience in adolescence and puberty, when of course we have a lot of hormonal disorder, and there are lots of cases of eating disorders during adolescence due to hormonal disorder as well, but also a lot of mood swings again with adolescents. So there again, mothers, family, or therapists, they have to look out for mood swings, and all kinds of mental health signs that they might, indicate for also an eating disorder. Then let me just see. I had also quite some clients that they had abrupt changes during their lifetime, as times that they would get really tired, they wouldn't want to do anything, they would get depressed, and that would be associated with an eating disorder, or they would act like superwomen, doing too much, being into perfectionism. So also watch out on that. And last thing that I wanted to just say, if you actually see any of these warning signs, and then your client, and you have like records from the past, please watch out. Now, if you do indicate any of these warning signs, and you know that the client has a history of depression, of alcohol or drug addiction, they must have been criticized while they were very young, and especially up to 7 years old, for their eating habits, or they had parents suffering from eating disorders, or they have been, let me just repeat again, severely criticized for their eating habits, their body shape, their body image, or their weight. And if then again, for any kind of reason, they must have gone through a lot of peer pressure or family pressure. There's a lot of occupations, such as dancers and actors and models and athletes also, that because they're receiving a lot of different kind of peer pressure, they tend also to have we tend to see a lot of warning signs of them having an eating disorder. And last and most common, anxiety, low self-esteem, obsessive personalities, perfectionist, as I mentioned before. And of course, again, and last thing I'm going to say, I don't want to take too much time, people who have gone through trauma, different kinds of traumas in the past, or being sexual abused, and a lot of these, big number of these are women, as you already know. Yes, and I'm going to stop here. If you want to ask anything, I'm happy to answer or contribute for anything else, for any other questions. Thank you ever so much. You're all lovely and beautiful.
And actually, that's one of our questions from one of the clinicians, a group of clinicians, holistic wellness practitioners group on Facebook. So, but we're gonna ask that question once we wrap up. So that may be a question that you want to take,
Yeah.
and then you kind of get some time to kind of gather the answer.
Yeah.
The question comes from a practitioner in North Carolina here in the United States. And he's asking, do you feel like eating disorders are more of a female issue or a male issue? So I'll let you kind of salivate on that question a little bit.
Yes,
And then
thank you.
once we're done and we're ready to jump to the questions, I'll let you take that one. Okay. So our next question is question number 4 is for Dorothy from Malta. What if eating disorders are left untreated on time? Dorothy, I think you're muted. 1 second. Let me unmute you. Okay.
Okay.
Okay, now.
Okay, so I'll start again. So thank you for having me. And I'm a clinical psychologist, psychotherapist, and eating disorder specialist. And my question is, what happens if eating problems, ones that we've mentioned so far, and disordered eating goes untreated? Really and truly, it could go either or way, with either being a minority and or being a majority. What I mean by this is that there are situations where individuals, without necessarily going for therapy, manage to overcome their eating problem. And normally this would happen because they would encounter some meaningful life situation or a stage in life, something which gives them a different kind of meaning, and it helps them to shift from the eating disorder mindset to this other life situation. This could be cases I've seen, people who stopped coming for therapy and then they resolved the issue. It's because there was the birth of a child or the start of a happy relationship, and always with where a lot of love, as Rachel explained, is involved. So they feel held, and somehow there's a shift in focus. As I said, this would be the minority, even research shows this. The majority, unfortunately, would keep battling with eating issues. They're normally referred to as the eating disorder mindset. And this could last not just for years, but decades. We've had people coming and they say, I've been 30 years doing this. And finally, I took up the courage and I come for help. So what would happen is that they can either stay in their original eating problem. So let's imagine that they are caught in a vicious cycle of the binge purge, which is very common. And they would go in and out of it, depending on what they're going through in their lives. So when there is a major life stressor, normally it worsens, and then they could calm down. And very often they would either try the different trends of dieting that would be present. So whether it's raw food at this time or going vegan or going vegetarian, they try to resolve their issue through what is happening around them, but they're never tackling the cause. Some others progress. So from somebody with restrictive anorexia nervosa, for instance, they could shift towards binge eating disorder. So then they have a double issue because they put on weight and they cannot cope with that. People know them one way and now they've become another. So they're caught in another kind of mindset, and they come up with extra dieting rules. Then there are those who keep shuttling from one to another, and they change their compensation method. So sometimes they use the purging, sometimes they're using the exercise, sometimes they're using the fasting, but they're never free. So they're never free to live their life completely. And this interferes with being happy in life. Comorbidities are very common, so these people often then tend to develop anxiety, other physical conditions, and depression. Worse than this is we know that eating disorders have among the highest mortality rate among psychiatric cases. So we know of cases where people lose their lives, and this happens either through suicide or through cardiac arrest. And this happens when there is malnutrition or an imbalance in electrolytes, or through over-exercising, but we know that this is a reality, it's a fact. I would like to end up by saying that if anyone has these signs or these symptoms, to reach out, to reach out to a professional who is trained in working in these disorders, because there is cure, there is hope, and people do recover with a lot of hard work and, with a lot of patience and a lot of support, but cure is possible. Thank you. So then I'll take questions later.
Awesome. Thank
you.
Thank you,
Dr. Jefferson.
So you guys, we got some really, really great people that have a lot of experience in treating eating disorders. I think this one's a really good treat for a lot of the questions that we got. So let's talk about where this video is streaming, because it's in a couple of clinicians group. So the groups that we have clinicians that are treating people with eating disorders, and they don't necessarily specialize in the treatment of eating disorders. We're getting a lot of questions from them. And so I think this will be a great opportunity for you guys to kind of provide them with further information. And I think that they are definitely linked with the right type of energy today. So I think that you guys have given them a lot of information, a lot of really useful information, and they have some further questions, and you kind of touched on some of the things that they've asked about. They've asked about comorbidity. They asked about the correlation between suicide and people struggling with body image and eating disorders. And so maybe you'll be a good one to take that question. But yeah. So we'll jump into the next question, and that means we're closer to questions, you guys. I know that we're pressed for time, but we're closer to questions. We only have 2 more questions now before we wrap up. So the next question is Jessica, and she's in Italy. And we're talking about diagnose now. So what are the correct ways to diagnose an eating disorder?
Hello. Yes. Yes, my name is Jessica Combi, and I'm a psychologist and a psychotherapist from Italy, and I work in a clinic specialized for eating disorders. So, okay, to start, I think it's important to say that diagnostic interviewing is crucial to both clinical work and research with patients with eating disorders. Of course, this process is essential for the treatment planning. It provides information about the outcome and could provide also the foundation for the therapeutical relationship. This process, of course, could be difficult for a number of reasons. For instance, patients often report difficulties remembering their symptoms in an accurate way. They can try to minimize them in order to avoid the treatment, or they may lack of awareness to be able to answer. When we ask, for example, about the influence of the shape or the weight on the self-evaluation, this could be a complicated concept that requires patients to have both the self-awareness and the abstract reasoning ability to identify how to determine their self-evaluation. Eating disorder patients often feel isolated, as a colleague before already told, ashamed, confused about the disease. So empathetic questions that reveals a deep understanding about thoughts, feelings, and behaviors can facilitate an alliance between patients and the clinicians. So going to the diagnosis process, let's see in details the procedure we use to follow. prior to the assessment, all patients should fill in questionnaires like the Eating Disorders Examination, the EDQ, and the Clinical Impairment Assessment Questionnaire. So we can determine the severity of the eating disorder in order to have a starting point. Then we go to the real psychological assessment. Going to the, I'm following also a psychoanalytical approach because, so going to the roots of the disease, its characteristics and the related difficulties. First, we explore the reason why they are asking for help in that moment. So, and then we explore the beginning of the disease, the current problem as it's perceived by the client and also by the others. Then we do an accurate anamnesis, possibly also with the mother separately, in order to investigate also the feeding and the weaning period. For instance, I took part of, but today we don't have time to talk about it, but I took part to a scientific research with the University of Milan, and we saw and we explored how the feeding time and the weaning time is correlating to the start of the eating disorder during the puberty and adolescence. Then an exploration of the eating habits. We used to do an exploration of the eating habits of the client and also of the family. Very important is also to explore the atmosphere during the meals, for example. Then we can use other questionnaires, for example, the SCID-1 or personality tests like the Rorschach personality test or the Blackie pictures, in which we explore the, we investigate, okay, the origins, yes, the personality. And we can use also an intelligence test in order to explore the cognitive resources. And at the end of this process, we build the treatment plan, and so we can start the real treatment. So that's it. Thank you.
Awesome. And I would love to hear more about your study as well. So if you can kind of send me the details after, that would be great.
Okay.
So we're going to jump into my question. I'm the last part of this wonderful presentation. And so I'm going to talk about how eating disorders are treated. And I guess it's a really, really simple question because you guys have kind of summed up a lot of the treatment modalities for eating disorders. And one of the questions on here in the group was, do you guys prescribe psychotropic medications for eating disorders? I know for me, I believe in holistic wellness, and my background is a medical doctor. It's kind of before I became a psychotherapist. But as an MD, I've never prescribed medications for people unless they were struggling with comorbidities. So the way that I see it is people sometimes struggle with the raspy throat, sore throat, because of course, if you're vomiting frequently, you would need something to help you alleviate the symptoms of the sore throat. It's sometimes red, and you can use throat lozenges oftentimes for that. Honey is really good for that if you're looking for a natural way to alleviate some of that as well. But you can also struggle from some gastrointestinal issues as well. So I say psychotherapy is an amazing modality. EMDR has also proven to be quite effective in alleviating some of the traumas associated with people who are struggling with previous issues that affect their personal views of their body image and other things that they're dealing with that are underneath the surface that present. Sometimes people need more of an intensive treatment regimen. So inpatient treatment, partial hospitalization, intensive outpatient treatment. these are some of the options I've seen that are doable, that work for some people, but also regular outpatient and consistent outpatient treatment. But what I see to be the most effective is finding a means to connect with the right type of practitioner and a systemic support network that allows them to share their perspective of what their journey looks like. And sometimes just having somebody to listen to what you're going through so that you can kind of introduce what it is that you're going through, so that you don't have someone, like Rachel said, that makes it about them. And so you have space to express your purview, your perspective, and what your initiative looked like. And then, so I think it was Jessica that talked about substituting one means of outlet and with another. I can't remember which one of you it was, but finding another way to find freedom and do another thing. But a lot of times that's just what it is. But finding ways to be free, finding another way to live, right? And find those pieces of you that make you feel more whole. And sometimes we just need that. But I think that psychotherapy is definitely an effective means to alleviating the symptoms that cause the various types of eating disorders. But the number one thing that we typically try to do, because as we talked earlier, the leading types of eating disorders typically lead to off state or off balanced weight. So the number one thing we try to do is get people to a healthy weight. And then when they're back to a healthy weight for their BMI, then we can kind of start talking about what realistic goals look like and things like that in therapy, and kind of get them to a point to where they're able to kind of share their experience and their perspective of what's ideal for them as far as their body image, as far as what their experiences look like and that kind of thing. So I think having a good psychotherapist, I think having a long-term plan and a short-term plan that makes sense, having a proper support group, and then also having the resources, crisis plan, these types of things I think are very, very important. And knowing what it is that you're dealing with, right? So I guess reality checking. So that's pretty much what I've got. I'm gonna jump into questions. Let's see. If you guys have anything else that you guys want to add as we wrap up. While I pull up these questions. Oh, I probably have to.
Yeah, very briefly, just to say something I think Dorothy mentioned, you just mentioned just before, which is actually to find the freedom, as you just said. Sounds really nice and poetic, but this can be achieved also through practices of mindful eating, intuitive eating, and everything has to do with mindfulness can really, really support getting towards this freedom and balance, holistic balance that we all need. So this is just something very briefly. Thank you.
Okay. So what order did you guys want to proceed with the questions? I know that we were going to answer that question about perspective exploration. Is eating disorders a female issue? Because I know that one came first from the holistic wellness practitioners.
Yeah. And sorry for that. That's me again. Sorry for that. Just to say, this is very interesting. As I'm also the head of a female organization in Middle East, which is for women's empowerment, for coaching psychology. So I'm maybe not the right person to answer this question, because maybe it's also somebody who's male who's asking. But yet again, I have to say that it's not only a female issue. I think it's an issue for both female and male. And I think, and I deeply think that because there is women in a global level, we're used to discuss a lot and we have a voice around these subjects. And I think in this way, I feel that men, again, in a global level, I feel we have a little bit left them aside because they're not very extrovert in this way. But I think it's an issue for both. And I think at the end of the day is something very, very important is no matter if it's a female or a male. And I think Jessica mentioned that if they find a good therapist, they will get to the root of the issue and we give them the right strategy to be able to go through in a successful way and in a positive way and achieve that, then this is what is important. And I think it's both a female and male, and we should not discriminate at all. We should not discriminate. Of course, it's both. We love guys as well. We love everyone. It's we love you guys. If it's a male therapist, we love him as well. Don't worry about it.
So before we jump to that other question, because I'm having a problem with pulling up the chat and allowing it to stay up here. Can you guys see? There was one. I know there is one that's up there in the chat, but there is another question that says during the pregnancy, majority of women experience PICA. Can that be classified as eating disorder? Yeah, eating disorder. Yeah. I'm losing my chat. I can't see it all the way. I'm not sure who all can see the full chat. Can you guys see it?
Yes, it is PICA, eating disorder in pregnancy.
Yeah, we're almost done, Rachel. But yeah, but no, because PICA is considered to be one of the what do they say, side effects of pregnancy, like nausea and vomiting. And no, it's separate from eating disorder. So it would be like when you're ruling out, when you're doing rule outs in your DSM, it would consider to be a medical condition.
In PICA, the pregnant woman eats something that is not food. So if it vomits or something else, it's not PICA. But they are eating dust or glue or something like that is PICA.
Hold on. We have one more. What are the comorbidities when it comes to suicide, the numbers for suicide and eating disorders? Who had that question? Anybody wants to take that one?
Well, I don't have an exact statistic for this current year, but what we know, literature shows, and possibly Jessica, because you mentioned doing a lot of research, and I know Italy is very good with collecting data. I studied there. We know that there is eating disorders have the highest mortality rate among psychiatric populations, and very often when we look at what has caused the death, I wouldn't say the majority, but many of them, it would be suicide. And we know that attempted suicide is also very high It's not because they get an ideation, you know, when they want to do it, but because they're so tired of what they're going through, that they try to take away their lives. With younger ones, maybe when the personality is a little bit more impulsive, they use a lot of self-harm, and this goes in degrees. So they could cut themselves or burn themselves or pinch themselves, but then this could go to higher degrees. And this is also where comorbidities come along, and we would need to reassess to see what comes first. However, bulimia nervosa and self-harm go very much together. There's a correlation there, and this is where we need to, when they're young and when they're older, you advise other family members to kind of keep an eye, especially when medication is prescribed at the outset, because they tend to either feel better and do something, find the courage to do something, or else it could be a side effect the first weeks, and they get like a worsening of their symptoms, and that it could happen at that time. However, apart from suicide, cardiac arrest, because we know there are many medical complications for eating disorders, especially with anorexia nervosa, and cardiac arrest is then very common among those who end up being in hospital. But even not, when somebody looks well for their weight and they've lost weight, but they've lost it rapidly. So it is not how much the person is weighing today, but where they started off from. So that should also be taken into consideration, and then that is when we refer to the medical profession, you know, to an endocrinologist, so they look at their bloods. So I hope I managed to answer the question.
You know, I think that oftentimes I think what people are trying to do is to find a way to say diagnosis that's responsible for the increase in suicide rates amongst people who are struggling with mental health disorders, and that's not necessarily true. Just to kind of elaborate on what you were saying, so there isn't one leading cause of mental health. A lot of people correlate depression with suicide. That's not necessarily true. Jessica said,
There's some kind of interference, so I didn't hear very well. Like there's music in the background.
Okay. Yes. Sorry, if Claudia can mute herself.
Okay. I think it's muted now. But yeah. But so I think that that's the main problem, and the truth is, oftentimes we try to correlate one particular mental health disorder with suicide, and that's not necessarily always true. Oh, it's okay, Claudia. But we need to understand that suicide has a tremendous amount of implications, right? Other things that contribute to that mindset and that courage that it takes to move towards suicide. And it's not always mental health, related. But I think that when we try to understand what people are going through when they're struggling with eating disorders, one of the things that I want to kind of go back to and kind of mirror a little bit is that Rachel mentioned that it's not always due to age, adolescence. And in wrapping up, I want to make sure that we overemphasize that eating disorders affect a wide range of people. And it could look like people who are struggling with a noticeable weight issue, right? You can see them because they look very thin, and you can see them because they look overweight and obese. And it could also look like an average person that could, looks great to you. Eating disorders have a lot of different appearances because it's all up here in how they view themselves. They say perception is reality. And I think that's what we have to keep in mind. Eating disorders can afflict a wide range of people, whether you're male, whether you're female, whether you're young, whether you're old, whether you're middle aged. And when we're on the outside looking in, when we're a perfect stranger, when we're family members, when we're a husband or a wife, we need to be looking for signs and symptoms that look like people who are visiting the bathrooms right after meals, people who are not having a regular diet that looks like we eat breakfast, lunch, dinner, a couple of snacks a day. People who sometimes don't eat at all for long periods of time. And then all of a sudden they go and then they're eating a lot. And then they feel really guilty about having eaten everything in the refrigerator, everything in the house once a month. And then they may not even feel like they want to go and throw up, but they just binged and have eaten all of that stuff, right? And they may not be struggling with weight, but that's still an eating disorder. That's still an affliction, right? They're just doing it. May not be depressed, may not be going through anything, but obviously there is something underlying in their eating patterns and their eating habits that says that, okay, this person just might qualify for an evaluation. One of you mentioned the importance of psychiatric interviewing. We have to understand it's really important, even if we're not looking to diagnose for an eating disorder, to do a full interview and go through and assess for how are you eating? How are you sleeping? Because those questions are so important that sometimes we don't even notice how important that nutritional assessment is to just making sure that these people are properly calibrated, that we're seeing every day. Because they're still regular people just like us, and they could be struggling with an eating disorder, even though they're in there for something else. Could be in there for couples counseling, right? So with that, we're going to wrap up because I know that we are crunched for time and you guys have got other things to do. I think that we should definitely do a part 2. It was great sitting with you guys, sharing information and insight. I definitely look forward to some of you guys sharing some of your wealth of knowledge with me in the future. And until next time.
Bye.
All right, you guys.
Thank you.
Bye.
Thank you.
Bye.